Have you ever been at a dinner table or sitting quietly in a room with people you love and felt that familiar urge to clear your throat, again, and tried to do it quietly, but it just wouldn't go away? You cough, you swallow, you sip some water, and within 60 seconds it's right back. That thick, sticky feeling sitting at the back of your throat like something is permanently lodged there. Tell me honestly, how long has that been going on for you? Weeks? Months? A year or more? Because if the answer is months or longer, I need you to stay with me right now. Because what I'm about to share with you in the next 15 minutes genuinely changes the entire conversation. Here's what almost nobody tells you. That stubborn throat mucus, that constant need to clear your voice, that feeling of something stuck, it is almost certainly not a throat problem. It is not a lung problem. And it is almost certainly not what your doctor told you it was the last time you went in. The real cause is hiding in a place most patients would never think to look. And once I show you exactly where it's coming from and why your own body is doing this to you, every single piece of this puzzle is going to start clicking into place. More importantly, by the end of this video, you will have a real, practical, science-backed plan you can begin tonight. I'm Dr. James Hargrove. I've spent the last 30 years in internal medicine, and I can tell you that the condition I'm about to describe is one of the most consistently misdiagnosed problems in adults over 60. It is also one of the most fixable, but only if you understand what's really happening. So please stay with me because the most important part is coming up in just a moment, and I do not want you to miss it. Let me start by talking about what you've probably already tried, because I know you've tried things. You're not someone who just sits and suffers in silence. You've had ginger tea. You've sipped honey and warm lemon water. Maybe you've tried a steam inhaler, throat lozenges, or one of those mentholated cough syrups. Some of you have been to your primary care doctor and been told it's allergies. Others were told it was post-nasal drip. A few of you were prescribed antihistamines or nasal sprays. And while those things may have given you a little relief for a few hours, that thick, stubborn mucus always comes back. Am I right? You feel like you've been fighting this same battle for months and absolutely nothing is winning. I need to tell you the honest reason nothing has worked. Every single one of those treatments is treating a symptom, not the cause. It's like mopping your kitchen floor while a pipe is slowly leaking behind the wall. You can mop forever, but until you fix the pipe, the floor is never going to stay dry. And today, we're going to find that pipe. Before I go any further, do me a small favor. Drop a comment below right now and tell me how long you've been dealing with this throat mucus. I read every comment and I genuinely want to know. You are not alone in this, and sharing your story actually helps every other person watching feel less isolated. Now let's talk about the real story here. Most people assume that if you have throat mucus, it must be coming from your respiratory system, your nose, your sinuses, your lungs. And yes, sometimes it is. A common cold, a true seasonal allergy, living in a city with dust or pollution, all of these can produce temporary mucus. But here is the line that separates a temporary mucus problem from a chronic one. A cold lasts 7 to 14 days maximum. A genuine seasonal allergy improves the moment the season changes. But if you have had this thick mucus, this constant throat clearing, this sensation of something stuck in your throat for more than 4 to 6 weeks, and you have no fever, no typical cold symptoms, and no clear seasonal pattern, then you are dealing with something completely different. What I'm about to tell you is something very few people outside a specialist's office ever get explained properly. The true culprit behind most cases of chronic throat mucus, especially in adults over 60, is a condition called silent reflux. And I need to be very clear here because when most people hear the word reflux, they immediately think of heartburn, that sharp burning sensation in the chest after a heavy meal. This is exactly where the confusion happens, because silent reflux is not heartburn. In fact, research has shown that more than half of people with silent reflux never feel any chest burning at all. None. That is exactly why it's called silent. It sneaks up on you with no warning, no obvious symptoms except for one: the mucus you've been clearing every single morning. Let me explain what is actually happening inside your body. Your stomach is essentially a storage tank holding incredibly powerful digestive acid. Acid strong enough to dissolve a metal nail given enough time. Between your stomach and your esophagus, which is the muscular tube that carries food down from your throat, There is a one-way valve called the lower esophageal sphincter. Think of it like a gate. When you swallow, the gate opens to let food through. Then it closes tightly to keep that powerful stomach acid from escaping back upward. Here is the problem. As we age, especially after 60, that valve begins to weaken. Years of certain lifestyle habits, certain medications, body weight changes, even some of the foods we eat regularly, all of these slowly loosen that protective seal. During the day, while you're upright and gravity is on your side, you may not feel anything wrong. But here is what changes the moment you lie down at night. Gravity is no longer working in your favor. And from that weakened valve, what escapes is not always a big splash of acid. Sometimes what rises is more like a fine acidic mist, so light and so subtle that you cannot feel it. But that mist travels up your esophagus, all the way to a part of your body that is extremely delicate and absolutely not designed to handle acid of any kind. Your throat, your voice box, the lining of your larynx and pharynx. Your stomach has a thick protective coating that lets it handle acid every single day with no damage. Your throat has no such protection. So when that acidic mist lands on your throat tissue night after night, it causes a low-grade chemical irritation, a quiet, constant burn on extraordinarily sensitive tissue. And now here is the part that directly explains your mucus. When your throat senses that irritation, it does the only thing it knows how to do. It sounds an alarm and starts producing a thick, protective layer of mucus to shield itself. That mucus you've been struggling with every morning is not your enemy. It is your body's defense system. It is your throat building a protective wall, because every night while you sleep it is being attacked, and you do not even know it is happening. That is why every remedy you have ever tried has only worked for a few hours. You clear the mucus, but the irritation never stops. So your body simply makes more. You are winning small battles every day but losing the war. Because the real fight is not happening in your throat at all. It is happening down in your digestive system. But there is one more piece of this puzzle, and it is the piece that explains why this problem can feel so impossibly stubborn. There is an enzyme produced inside your stomach called Pepsin. Its only job is to break down protein in the food you eat. Inside your stomach, where it belongs, Pepsin is harmless and useful. But when silent reflux is happening, Pepsin travels upward along with that acidic mist, and it deposits itself directly onto the lining of your throat. There it sits dormant, almost like it's sleeping, until something wakes it up. And what wakes Pepsin up is anything acidic that you eat or drink. That morning cup of coffee, a glass of orange juice, a tomato-based pasta sauce, even sparkling water. The moment something acidic touches the back of your throat, that pepsin reactivates. And because there is no food protein nearby for it to digest, it begins working on the only protein it can find, the protein in your own throat tissue. It is essentially causing tiny, microscopic damage to the very lining it is settled on. Your body senses this attack and responds by producing even more mucus to protect the area. And the cycle continues, day after day, year after year, until you address the actual root cause. Let me tell you about Eleanor. Eleanor came to see me at 67 years old. She had been retired for 2 years and described what she was feeling as a golf ball permanently lodged at the back of her throat. She had been to 4 different doctors before she came to me. One told her it was allergies. Another said post-nasal drip. The third blamed it on dry air. The fourth suggested anxiety. She had tried antihistamines, nasal rinses, 3 different humidifiers, and every herbal tea on the supermarket shelf. Nothing made a meaningful difference. When she sat across from me and described her symptoms in detail, I recognized the pattern immediately. The mucus was always worst when she first woke up. Her voice was hoarse for the first hour of the morning. She slept flat on her back every single night. She drank a tall glass of orange juice with breakfast because she thought it was healthy. And after dinner, she liked to lie on the couch and watch television with a small bowl of popcorn until bedtime. When we addressed the silent reflux directly, which I'm going to walk you through right now, within 6 weeks, Eleanor told me her throat felt clearer than it had in 3 years. That is what happens when you finally treat the cause. If this is making sense to you, if you are nodding along and recognizing yourself in everything I've described, please do me a favor and hit the like button right now. It genuinely helps me reach more seniors who have been told for years that their throat clearing is just allergies. I want as many people as possible to hear this. Now let's talk about exactly what to do. Understanding the cause is half the battle. The other half is having a real, practical plan that you can begin tonight. The very first step, and please take this one seriously because it is by far the single most powerful change you can make immediately, is to elevate the head end of your bed. I do not mean stack more pillows under your head. Stacking pillows only bends your neck forward, which can actually make symptoms worse. What you need is to raise the entire upper portion of your sleeping surface so your whole body rests on a gentle incline. The simplest way to do this is to place sturdy wooden blocks, 6 to 8 inches tall, under the legs at the head of your bed. A specialty wedge pillow that supports your full upper body also works well. An adjustable bed frame is the gold standard if you have one. This single change, using gravity to keep that acidic mist where it belongs while you sleep, has helped many of my patients notice a significant improvement within just 3 to 5 nights. If you try nothing else from this video, try this one thing tonight. The second change is your sleep position. The anatomy of the digestive system favors sleeping on your left side. When you lie on your left, gravity helps keep the contents of your stomach lower in the cavity, further from that valve at the top. Many of my patients who switched from back sleeping or right side sleeping to left side sleeping reported a noticeable improvement in their morning throat symptoms within 2 weeks. The third change is timing. There is one rule I give nearly every patient with silent reflux, and it is this: stop eating anything, and I mean anything including small bedtime snacks, for at least 2.5 to 3 hours before you lie down. Your stomach needs that window to empty itself before you remove the advantage of gravity. A stomach that still has food in it when you lie flat is a stomach that is far more likely to allow acidic mist to escape upward into your throat. This single habit change, combined with elevating your bed, can produce dramatic improvement within 2 to 3 weeks. The fourth change is the size of your evening meal. Lighter is genuinely better. Heavy, fatty dinners take hours for your stomach to fully process. Try making your evening meal the smallest and lightest meal of your day. Lean protein like chicken or fish, gently cooked vegetables, and modest portions. Save the larger and richer meals for lunchtime, when you have the rest of the day upright in front of you. Now I want to talk to you about specific foods and drinks that many people with silent reflux find consistently make their symptoms worse. These include coffee, alcohol, all carbonated beverages including sparkling water, chocolate, peppermint, citrus fruits and juices, tomato-based sauces, very spicy foods, and anything deep-fried or heavily greasy. I want to be careful here because every patient is different, and your personal triggers may vary. But if you are willing to run an experiment, I strongly recommend significantly reducing or temporarily eliminating these items for 3 to 4 weeks and observing whether your throat improves. Think of it as a personal investigation. You are gathering real information about your own body. Here is something that surprises almost every patient I share it with. Peppermint, despite feeling soothing on the surface, actually relaxes that protective valve in your stomach, which can make reflux worse, not better. So, peppermint tea, peppermint candies, mint-flavored gum, and even strong mint toothpastes used right before bed may not be helping you the way you think they are. On the other hand, chamomile